In this video, we'll discuss the importance of picking up on patient cues and responding appropriately. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. We have briefly mentioned the importance of picking up on patient cues as a crucial empathetic skill in other videos. But how do we actually do this? In this video, we discuss some tips for picking up on cues and how to use them. Being able to decode non-verbal cues is a crucial part of trying to understand a patient's feelings. In a consultation, people aren't always very open. Their thoughts and feelings can be hard to express. Instead, they might use indirect or tacit messages, and responding to these can sometimes be the only way of exploring a patient's concerns. Patients can convey what they are really feeling by hinting at it verbally or using non-verbal behaviour. This can include their body language, vocal clues such as hesitation, or a change in volume or facial expression. When these happen, it's important to explore them from both the biomedical perspective and the patient's perspective. Patient cues can be almost anything and will depend on the situation, which makes it really difficult to teach practitioners about specific things to look out for, as the list would be endless. So we're going to provide some simple guidance on how you may deal with them when they occur. Firstly, picking up on non-verbal clues is very important, as it helps you to understand the emotional impact of a patient's illness, and it can sometimes allude to the physical problems that the patient may be experiencing. It can be therefore considered a useful diagnostic tool in its own right. However, noticing the cues is only half the work. You need to be able to interpret these correctly. There are a lot of things that could possibly distort or cause you to misinterpret what the clues actually mean. For this reason, not only do you have to observe very carefully, you should also verbally and sensitively check that your interpretation is the correct one. When you check your assumptions with the patient, it can also encourage them to discuss their concerns in more detail. Let's say, for example, you thought a patient was showing a few signs that they are a little bit anxious about a new medication. You could say something like, "Am I right in thinking that you're a bit worried about starting this treatment?" This may then help your patient to open up and explore that concern more deeply. Sometimes we need to make sure we're in tune with the issues that are psychosocial or of emotional nature for our patients. A patient telling you, "I've been having a really tough time lately and the pain seems to be worse." It's easy to focus on the pain and ignore the fact that they've been having a tough time. What we need to do is explore what the patient really meant when they said they were having a tough time, because this also may be linked to the physical issues relating to the pain. What happens if we miss our patient's clues and cues? One study by Leveson in 2000 found that 50% of consultations contained one or more cues. The same study found that in primary care, only 21% of these cues were responded to, despite all of them being a very important avenue to explore the patient's perspective. Not responding to these clues can have two main effects. Firstly, you might misinterpret what the patient meant if you didn't follow up, chunk and check with your patient. And secondly, not responding to these, especially if the patient has repeated them maybe once or even twice, could give the impression that you don't care or you're not interested in that subject or topic. This can be particularly damaging for the patients who may have been already apprehensive about raising that concern or worry that was in the back of their mind. It's a misconception that responding to patients' cues takes up too much time. The Leveson study showed that by picking up and responding to these cues actually shortens the length of the consultation. This study ultimately concluded that picking up and responding to clues was the key to building a trusting, patient-physician relationship, thus improving the outcomes of care. This idea is closely related to exploring the patient's ideas, concerns, expectation, or ICE as it's commonly known. Other videos on this channel will explore that in more detail. We've talked about communication skills in depth across many videos on this channel. It's worth noting that you need to be very aware of your own non-verbal cues that you're displaying, as these will influence your patient. If you really want to encourage your patient to open up and show that you're listening to them, you need to make sure you have good eye contact, showing that you're interested, and not give out contradictory messages from your voice to your non-verbal communication. In summary, we've discussed some ways of picking up on patient cues and discussed the importance of this. There's lots of skills and competencies that make up a good patient-centered consultation, and all of these need to come together. So check out some of our other videos on this channel to refine these skills further. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page, and subscribe to these videos.